Thank you, Dr. Ilongo. We'll actually start with a word of prayer, and let's bow our heads for the prayer. Heavenly Father, we want to come before you. We want to thank you. We want to honor you. We want to graciously glorify your holy name for the gift of life, O King of glory. We also want to thank you, God, because we have enjoyed good health. And we also want to thank you, God, because you have given us this noble exercise to save the patients that you have given us. Heavenly Father, as we come before you, once we are marking this Patient Safety Day, Heavenly Father, we want to invite you into our midst. We want also, Heavenly Father, to ask you for your guidance and even be our planner, God, as we start this day. We know very well we could have marked this day physically, but because of the conditions that are there, we can't. But God, we accept the way it is. And God, we want to release ourselves before you. We also want to thank you for all the participants and all the panelists who are on this. And God, may you continue blessing them and may you continue guiding them as we elaborate on very critical issues concerning the patients and each and every person, because even us, we are just patients in waiting. We want to honor you. We want to graciously glorify you. And we pray this shortly, believing and trusting in the name of our Lord Jesus Christ.
Amen. Thank you so much, Veronica. Thank you so much, Veronica, for the prayers. Next, I wish to request Dr. Kutoi to lead us in defining the housekeeping rules for this webinar. Oh, Lydia Ntisiki. Sorry.
Thank you very much. If you could kindly allow me to share my screen where we'll have the housekeeping rules. Okay, one of the things we would like to expect the participants to do is to kindly keep your microphones on mute. In case you have any questions to ask, then you could raise your hand or you could put your comment in the chat box, but we highly suggest that you put your questions in the chat box. We will be looking at them throughout the session and responding to them as the day goes by. We'd also like to request, if in case your bandwidth is not strong enough, if you could kindly put off your camera so that then you'd be able to join the session without much interruptions. We have limited screen sharing to a few participants. So for a lot of us on the call, we may not be able to share anything, but for those presenting, we have given you access so that you're able to share your screen when you're doing your presentations. But we kindly request that you only share your screen when you are requested to do your presentation. For those of us who are sorry, I'm a culprit of poor network. On the far left on your screen, there's a microphone looking thing, which lights up green when you're talking. If you could kindly switch it off, if you click it once. If you don't have the strike through, then that means we can hear you in the meeting.
Yeah. Sorry to interrupt you. Your screen sharing is not, your screen sharing has stopped. Can you please reshare your screen?
Sorry, yeah, sure. Are you able to see it now, Tanya?
It's still loading. Yes, now we can.
So I was saying on the far left of your screen at the bottom, Then you have the unmute and unmute button. If you could click it, if it has a strike through, then you are muted. If it doesn't have the strike through, then we in the meeting are able to hear you. Then we also have the chat. So it is clearly marked at the bottom of your screen. So in case you need to write a comment or a question, then kindly click it and then you can share. You have an option of sharing to the whole meeting or sharing to a particular person. This is what the mute button looks like. So when it has a strike through, that means you're muted. Then you have the option of raising hands. I don't know if we'd be able to take live questions, but as we said before, once you put your comments or questions in the chat,
Wanasema atikatwe kwa remeji. Walikubaliana wataka kila mtu aanze.
Asenath Monari, if you could kindly mute yourself. Thank you. Kindly, participants, please keep your microphones on mute throughout the meeting. As we said before, if you have any questions, please put them on the chat box. Asenath, kindly keep your microphone on mute. Thank you. Okay. I'd like to return it back to the patient safety team. Kindly, if you could take it over.
Thank you so much, Lydia, for those housekeeping instructions. Next, I wish to welcome Dr. Emmanuel Tanui to make some welcome remarks on in place of Dr. Morris Wakwabubi. Karibu, Emmanuel. Emmanuel, can you hear us?
Unmute him, please.
Yes, good morning, everyone. My name is Dr. Emmanuel Tanui from the Ministry of Health, under the Directorate of Health Standards, Quality Assurance and Regulation. I'd like to take this opportunity to welcome all of us to this auspicious occasion when we are marking the World Patient Safety Day this year. And quite appropriately, it's themed Safe Maternal and Newborn Care, because we do recognize that a lot of issues surrounding maternal care are usually predisposed to unsafe acts, which actually affect our patient outcomes. So it's quite appropriate for us to actually focus on maternal and newborn care at this time. So as we embark on this webinar, is important for us to actually focus our minds, and even as the speakers are going to speak about the different areas and activities that they carry out that assist or help to alleviate unsafe acts around patient care. As a ministry, we also engage in a lot of activities that help guarantee patient safety as well as healthcare safety. We know that patient safety is not guaranteed without thinking about healthcare safety as well. So we are hoping that this webinar is going to shed a lot of light and ideas on how we can be able to improve these issues. So thank you very much for taking time. I know we have a lot of other competing agendas, but nonetheless, we do recognize that the effort and time that you've taken to join us. So karibuni sana, and I wish all of us fruitful deliberation today. Thank you. Over to you, Dr. Irungu.
Thank you so much, Dr. Tanui, for the opening remarks. Next, I want to invite Dr. Evelyn, the head division of patient and health worker safety, to give us an overview of the World Patient Safety Day. And allow me to share a screen. Welcome, Dr. Sangula.
Okay, thank you. Good morning, everyone, and thank you very much for finding time to be on this webinar this morning as we host and commemorate the third World Patient Safety Day today. I want to sincerely appreciate the time that you've taken off your schedules just to come and mark this day with us and go through the different aspects that we can be able to put together as we try to make patient and healthcare workers' safety our priority as a sector. So this morning, it's my pleasure to bring to us the overview of the World Patient Safety Day, where we started and where we are at, very briefly, so that I also give us time to go into the deliberations of the day that will really revolve around the theme of this year, which focuses on safe maternal and newborn care. So I am from the Ministry of Health, and I just want to begin this session by having a brief overview of the organization within the Ministry of Health currently. And I think this is a clear demonstration of the commitment that the ministry has towards patient and health worker safety issues. The fact that we have an established Directorate of Health Standards, Quality Assurance and Regulations, I think is a good indication of the commitment of the ministry towards ensuring that there is safe and quality care that is available for all Kenyans. And I think it didn't just stop at the establishment of the directorate, but further went to the establishment of two critical departments within the Ministry of Health. That's the Department of Quality Assurance and the Department of Norms and Standards. These two departments are critical because in the absence of norms and standards, then we cannot assure safety, we cannot assure quality. And also in the absence of quality assurance, then how do we monitor that actually the kind of services that we provide for Kenyans are of the desired quality? So the Division of Patient and Health Worker Safety falls under the Department of Quality Assurance. And I again emphasize that the fact that this has actually been established at the ministry level means that there was thought that was put into this whole process, and that thought process was critical because then it gave a rise to the establishment of this particular division. And this is a clear indication of the commitment of leadership and their engagement in matters patient and healthcare worker safety. So within this division, we run 3 programs that are really active. Our flagship programs under the Patient and Health Worker Safety Division have been our infection prevention and control programs and the antimicrobial resistance programs. And now we are actively working on developing policies and the strategies around patient and health worker safety. So that's how we are organized, largely within the Ministry of Health. And I know in the health sector, as you can see from that slide, we are organized in different levels, right from the national level and right to the community level, because we really can't talk about patients and not touch the community level. So we have that the different levels of services within the Ministry of Health. Next slide. So just a brief background on the Patient Safety Day, why and how this came into being. First of all, there have been several attempts right from the year 2002 to advocate for patient safety efforts. But you can see between 2002 and 2019, nothing much had happened, despite the implementation and despite the proposals that have been put forward to try and advocate for safe care, to try and advocate for safe surgery. But up until May 2019, during the World Health Assembly, we didn't have a dedicated health day to mark the patient safety initiatives. So during the World Health Assembly in 2019, through the resolution 72.6, there was an agreement that we need to observe global action on patient safety annually. And the date that was agreed upon was the 17th of September. And that is why we are here today, first to enhance the global understanding of patient safety, because we know that everyone who walks into a healthcare setting needs to come out safe. Because for the healthcare professionals, we've taken an oath to ensure that we do no harm. So we want to enhance the global understanding of patient safety through advocacy and increased public engagement regarding healthcare safety. We also appreciate the fact that our public or the citizens probably don't quite understand what patient safety is all about. And if they do, they probably also don't understand that they have rights. And how can they actually put their rights into practice to better ensure that their healthcare is assured in terms of safety and quality. The third objective of the global World Patient Safety Day is to promote global action to prevent and reduce avoidable harm in healthcare. And when you talk about global action, one of the things that we have learned over time and a critical component of action when it comes to healthcare is that you cannot actually move into the action area without involving the political leadership of any country. And patient safety is not unique to just one country. This is an agenda that is at the core of the delivery of healthcare services in every country. So when you have global action, that means you have concerted efforts. And when you have the world speak in one voice regarding a certain agenda, then you're able to generate the desired traction, attract the desired resources, mobilize the necessary technical expertise to actually be able of care. And the other aspect about the World Patient Safety Day is that each year we actually have a new theme that is selected to shed light on a priority patient safety area where we think action is needed. And that is why this year you in 2019, our theme was to speak up for patient safety. We gave the patient the center stage during this year, and we actually had a very good engagement. We were able to bring in patients who shared their experiences with regards to receiving healthcare in our healthcare facilities. So we focused largely on the safety of patients. Were at risk of occupational hazards and occupational exposure to infections while on duty. We also, quite sadly, lost a number of healthcare workers due to the emphasizing from the division perspective that we are very good at taking care of patients. but who looks after the care of healthcare workers? So last year was actually our opportunity to speak up for healthcare workers' safety, because if the health worker is not safe, the patient safety cannot be guaranteed. So we spent time just looking at health workers' safety, and I'll be talking later on what we are doing just to ensure that we are not just speaking up for health workers' safety, but actually action is going to be taken to ensure that health workers are safe and to assure them that the system has their best interest. We apologize for that connectivity issue. So I hope this is where we were before we got disconnected because of internet issues. And we were talking about the significant burden of harm that women and newborns are exposed to due to unsafe care. And I think where we sit, all of us agree that no mother or no woman should lose her life while delivering, and no child actually should be exposed to undue harm in the course of care. And the other focus area also is for us to be able to jointly, in a concerted manner, prioritize and address safety in maternal and newborn care, and focusing on the time of childbirth when most harm occurs. And again, we also want to bring into focus the disruption of healthcare services, which we saw due to the COVID-19 pandemic. And at a country level, we remember the discussions that we had at the beginning of the pandemic, when we had a lot of our health services disrupted. And we had one of the doctors come up with a solution to try and actually bring relief and save mothers and newborns right in the middle of the pandemic, with a very innovative idea. And again, we also know that women's experiences during childbirth can be affected by issues of gender equity and violence. And this violence could be in the society, it could be in different forms. And finally, we also want to highlight the importance of respectful care in whichever context care is happening, and the linkages with safety. So as we work towards ensuring patient safety, it's not just safety from our perspective, but we also want to underscore the importance of respectful care while providing our healthcare services. Next slide, please. So when we look at the global burden of unsafe acts during maybe childbirth, the statistics that have been projected by WHO is that every day, nearly 5,400 stillbirths occur. You can imagine the pain of the mother that has to go back home after carrying a pregnancy for 9 months, only to end up with a stillbirth. And then 810 women losing their lives daily because of unsafe care, and having to record and actually just document 6,700 newborns losing their lives. And what we are saying is that most of these lives can actually be saved through the provision of safe care. And during our panel discussion, we'll get to hear just how best can we be able to use what we now know to make sure that the kind of care we provide can avert the loss of these lives that we are seeing coming out as statistics. They could be numbers, but to a family, that is actually all that they had. That is where their hope was. So if you can be able to avert pain, then we should go all the way to make sure that we do the right thing. So some of the key messages that are coming out during this year's Patient Safety Day are addressing women during their pregnancy and around the childbirth, because all of us have a responsibility. It's not just about the healthcare worker, but what's the responsibility of the women during pregnancy? So we have key messages that are going out around this. What are the responsibilities of spouses or partners, or even families and communities? And in Africa, we live within families and communities. What are their roles to ensure that you're able to avert harm in the course of care? Health workers too have a role to play. The healthcare leaders and facility managers equally have roles to play in making sure that the environments are conducive for safe childbirth and newborn care. And finally, the program managers and the policy makers are key players in ensuring this, because without policies, it is impossible actually to be able to advance safe care when it is required. So where are we in terms of patient safety? I will just summarize. Like I said earlier, our flagship projects were around infection prevention and control and antimicrobial resistance. We have had a robust infection prevention and control program for the last 10 or so years, and we will be launching our third edition of our national policy today. So that just shows the growth that has taken place with regards to infection control. And we know infection prevention and control is central in the provision of safe care. Even at the point of childbirth, basic infection prevention and control practices like hand hygiene are so critical, in the absence of which mothers would end up with infections that actually could result in death. And of course, the other program was the National Antimicrobial Resistance Program, which is established and currently at the national and county level, implementing the National Action Plan on Antimicrobial Resistance. We can move to the next slide. So we've also worked on integration, where you realize that patient safety is also a system issue, a health system issue. You can't just have it siloed. And that is why through the joint health inspection checklist, the different areas of focus have advocated for the minimum patient safety standards that any healthcare facility must put in place to ensure that the services that they are providing are safe and of good quality. Next slide. We've also taken note that medication safety is a critical patient safety issue. And through the Pharmacy and Poisons Board, we have a robust pharmacovigilance program that tracks the rational and safe use of medicines. And through this pharmacovigilance department and the medicines information department, we are able to report adverse drug reactions. We are able to report poor quality medicines, and we use this information to assess different risks and benefits of drugs that are available in the market. And that goes away in communicating pending risks, and even advocating and providing guidance with regards to what should be retained and what should be withdrawn from the market. And also that information is useful for educating and informing patients regarding the medicines that they are using. Next slide. We've also integrated patient safety into our national quality improvement standards, and specifically the KQMH document. And we know that with the implementation of KQMH, we are able to track patient safety standards, and we are able to actually enhance the implementation of practices that will assure safety and quality at the point of care. So as part of our global contribution and growth at a country level, we are part of the WHO-led Global Patient Safety Collaborative, which is a joint collaboration between the UK government and the Swedish government in supporting our patient safety efforts at a global level. And the key objectives of the Global Patient Safety Collaborative rotate around engaging leadership to prioritize patient safety, ensuring that we have a robust education and training component that will support building competent, skilled, and compassionate health workforce through interprofessional education and training in patient safety. And finally, to support research capacities in patient safety. So these are the three key areas that we'll be looking at as a country under the Global Patient Safety Collaborative. So the Patient Safety Division has also engaged in a lot of capacity building and policy formulation efforts. And of course, during the COVID-19 response, we continue to develop and adapt guidelines and training curriculum to just support the whole process of responding to COVID and preventing further transmission of the infection. And of course, that comes with improving healthcare workers, knowledge and skills. And apart from that response from the IPC perspective at a national level, this year, we were able to appoint a National Patient Safety Advisory Committee, which has a patient representative to oversee the process of development and implementation of the patient and health worker safety and quality of care policy. So we are developing a policy that encompasses patient safety, health worker safety, and quality of care all in one. And we also now have partnered with ECHO India and IPNET Kenya and CDC to just host a virtual capacity building platform that will be used to build capacity and also provide mentorship across different levels. So today also, as a result of the work within the division, which we recognize plays a key role in improving the safety of patients across the different levels and also healthcare workers, we'll be launching 4 strategic documents: the National IPC Policy and Strategic Plan, the National Action Plan for the Containment and Prevention of AMR, and that's the Monitoring and Evaluation Framework for the NAP, and another document which we call the Diagnostic Stewardship, which is a clinician's handbook for microbiology, because we realize that all these support patient and health worker safety efforts at the end of the day. So what are some of the challenges that, that we have come across even as we worked towards establishing a national patient and health worker safety program? One, sustaining commitment to safety and quality. This has not been, as much as this is at the center of healthcare delivery, commitment to safety and quality has not been at its best over the last couple of years. But I think as we continue engaging on these platforms, we will be able to build capacity and have a critical mass of champions for safety and quality. Again, the place of limited resources, both when you look at finances and human resource, I think resources are usually not adequate. So because of that, you have competing interests, and the focus sometimes is not on what we think, what we know is really a critical element that needs to be addressed. Then you have a system that is not well integrated, and the linkages across different players is not clear. So that is also one of the other challenges that we're trying to work through. And of course, patient safety requires a big change in terms of attitude, in terms of behavior and practice by healthcare professionals, the patients themselves, and different providers, and even the general public. And finally, sustainability of some of the interventions and some of the systems that are being deployed. So those are some of the challenges. And for us to try and address this, we are looking forward to finalizing our national policy that I mentioned before. And hopefully through this, we will have better direction as a country with regards to how we want to handle matters, patient and health worker safety and quality of care. So as I wind my session, we are looking forward to getting the country and the sector to a time and a moment when we will be proactive in terms of our response as far as and not be reactive, because I know in the past we have been reactive. We react when a situation happens in a healthcare facility, but when you have systems in place that assure patient and health worker safety, that means we are proactive, and we will be addressing issues in a wholesome manner, and that all of us will take time to reflect and envision patient safety. What do we want to see as healthcare workers? What do we want to see as patients? What do we want to see as caregivers at the end of the day? And finally, we are also looking forward to having deliberate inclusion of patient safety standards into all our clinical processes, so that we know that anytime I'm handling a patient, I am conscious about the different patient safety standards that need to be applied across the different clinical processes. So With that, I think we come to an end, and I end my session with a question. As we mark this 3rd World Patient Safety Day, I go back to this question that we have asked over the last, I think we also asked it last year. Do we have a clear and compelling vision for patient and health worker safety to keep us on the path of generating a future that we deserve to have? I know we all have a picture of what healthcare should look like at a country level, but do we have a clear and compelling vision, first at an individual level, at an institutional level, and finally at a national level, so that we keep on this path that we have started? When you start a process, it's not very popular because people don't see the outcome immediately. But I'm sure that when we'll be able to have a vision that's compelling, hopefully through the policy that is underway, we will be able to keep on this path to generate a future in healthcare that we all deserve to have. So that's the end of my session this morning, and I really want to thank our partners. We have come a long way, grown over the last couple of years in trying to advocate for patient safety. And I just want to say thank you for your attention. Back to you, Dr. Irungu.
Thank you so much, Dr. Wesangula, for that comprehensive yet clearly delivered overview on patient and health worker safety. The next step, I wish to call upon Dr. Kalondu to lead on the next session, which will be highlights by our key partners. So welcome, Dr. Kalondu.
Thank you very much, Dr. Irungu. And I'd like to say, Karibuni sana to all the participants who've joined us. We appreciate you, and we thank you for that. Allow me to stop my video for better connectivity. We apologize, we've not shared the program. Part of our partners are KNH, we have MTAPS, we have ECHO India, we have IPNET, we have CDC Kenya, and WHO. So I will start with Kenyatta National Hospital, and for Kenyatta National Hospital, we have Raeli Mukwana, who's the Director, Nursing Services. Nurses play a crucial role in healthcare, especially when we talk about maternal and newborn health. They are the key drivers in that process, together with obstetricians and all the other players that play that role in health sector. And we'd like to start with a voice from nursing team, and we appreciate Raeli Mukwana for attending this session. Prior to her role at the helm of nursing in KNH, Raeli Mukwana was the Assistant Chief Nurse at Labour Ward, and she's done a lot of research in that area. And therefore, she was the best person from KNH to come and talk about this partnership. So Karibu, Raeli Mukwana.
Thank you, Dr. Kalondu. All protocols observed, ladies and gentlemen. It's my pleasure to participate in this year's World Patient Safety Day, a virtual event on safe maternal and newborn care. So ladies and gentlemen, I'm here on behalf of Kenyatta National Hospital Management, and it is exciting time for maternal and newborn health. As Dr. Kalondu has told you, I've been a midwife for the last 23 years, and I've seen us making strides where patient used to come and it's the health worker who used to make decisions on what to do, as opposed to now when we are practicing patient-centered care. The patient also participate in their care. At Kenyatta National Hospital, our goal is to make pregnancy and delivery safe for all women, regardless of their background. So we appreciate the birth experience. We appreciate that the birth experience is not just a few days when the woman delivers a child, but it entails the 9 months before and a year or so after. So we offer comprehensive care, and we walk the journey from the antenatal period to the postnatal period. And now we are also involving men. So we allow men to also take part in this journey. So complications arising from pregnancy and childbirth rank among the highest cause of maternal and perinatal mortalities in our hospital. So most of these deaths are preventable if early intervention is instituted through a functional and robust referral system to improve patient outcomes. So KNH, in collaboration with partners, has set up a well-equipped, active critical care unit dedicated to our critically ill mothers. And we've seen from the time it was established, we've seen better outcomes for our critically ill mothers. Before we used to compete for space in our main ICU, which was, we didn't have enough space for our mothers. So creating systems to offer safe and quality maternal care should be a key deliverable to all healthcare facilities. As a hospital, we are dedicated to developing a secure environment for the patient and staff. With the increase in demand for specialized care, we hope to have systems and processes designed to offer safe, ethical, and respectful maternal care. I want to thank the organizers of this important event for their commitment to safety and improvement, and encourage us all to heed to the call to act now for safe and respectful maternal care. Thank you.
Thank you very much, Riley Mukwana. And our next partner is from MTAPS, Dr. Ndinda Kusu. Dr. Ndinda Kusu is the current project director for USAID Medicine Technologies and Pharmaceutical Services Program, MTAPS. And she's been a partner in this journey for the last several years. So thank you very much, Dr. Ndinda Kusu. Please make your remarks.
Thank you very much, Dr. Kalondu. It's indeed a pleasure for me as a person and us as MTAPS program to participate on this great day to drive the World Patient Safety discussions. Today, I actually remember my core business and the core business of MTAPS as a program. And we as MTAPS have been collaborating and supporting the government of Kenya in collaboration with other partners to contain antimicrobial resistance, promote good infection prevention and control practices. And we are also supporting other patient safety related initiatives. When it comes to antimicrobial resistance, we are working to support One Health multi-sectoral microbial stewardship in a few focus counties and at the national level. And then we are also supporting infection prevention control at the national level and in 4 focus counties. Other areas that MTAPS is involved in, it's supporting a response to COVID-19 with a focus on infection prevention control. And we are also supporting COVID-19 vaccine deployment through the different areas of, support for policy coordination structures, safety monitoring and pharmacovigilance, and the supply chain logistics management. The last area that again speaks to today's theme is support for the regional medicine regulatory harmonization work at IGAD and the East African community, really strengthening the regulatory systems and the regional cross-border pharmacovigilance agenda. Moving on, just a few highlights. When we look at the work we've done and multi-sectoral coordination, supporting really advocacy for containment of AMR. And on the right, what we see is really a joint communique advocacy on containment of antimicrobial resistance to ensure that our patients, our people are safe. And then we've also contributed to further, develop, review the current Kenya Essential Medicine List, classify antimicrobials by aware categorization, to further ensure that antimicrobials are used appropriately. We've not left the counties, and in collaboration with the counties, the national level and other partners, we are establishing One Health coordination structures in our focus counties. Moving on to infection prevention and control, again, under the leadership of the national level, working with counties, other stakeholders, we've been able to revise the national IPC policy and strategic plan, which will be launched. We've been able to undertake assessments at the beginning of the program and midterm, and we continue to do that, not for the sake of assessing the status of IPC practices, of AMR's practices, but to ensure we identify the needs, the gaps, and tailor-make the interventions that we've been supporting over the past 3 years. We've also been really working with stakeholders to establish governance structures that will lead to sustainable infection prevention control practices within the country. And we've not left the healthcare workers, the practitioners behind, supporting trainings at healthcare workers, and also partnering with professional associations for continuing professional development. When we look at antimicrobial stewardship, and the AMR is the silent pandemic that we are not talking about. And when it comes to antimicrobial stewardship, again, working with the national level, other partners to ensure that we have the first antimicrobial stewardship guidelines, and these are in implementation as we speak. We've been able to work to revive the National Medicine Therapeutic Committee and establish others in our focus counties, and also worked with partners and the Pharmacy and Poisons Board to develop a regulatory brief that has been disseminated with a goal of restricting use of antimicrobials in the country. And the last thing being really capacity building of healthcare workers and partnering with professional associations to build their capacity. So what are we doing at the cross-border areas? We say the cross-border areas are porous. People walk across, products walk across, diseases walk across the borders. So we are working with the IGAD region, the East African community, again, to build capacity for these cross-border areas to be able to promote safety monitoring, have pharmacovigilance, and ensure that people are safe from their products. Moving on, we've also quickly been supporting COVID-19 infection prevention control, building capacity across the different sectors, public, private, and the faith-based sectors. The last thing that we are now actively involved in is also supporting the vaccine deployment and building capacities, and we are in 9 counties building the capacity for the rollout, and again to ensure that we promote safety monitoring for these vaccines. We are also collaborating with the national level, WHO and other stakeholders to drive the patient and health worker safety agenda. I want to thank the Ministry of Health and other partners on this slide and beyond that have enabled MTAPs to do what we've been able to do, and also really plan ahead to continue supporting the country to promote good patient safety. Thank you, and over.
Thank you very much, Dr. Ndinda Kosu, and thank you for elaborating the great work that you're doing with MTAPs and the facilities that you've listed there. Asante sana. I'd like next to welcome Dr. Karan Rai. Dr. Karan Rai is the head of international initiatives at ECHO India. ECHO India is a non-profit organization that has dedicated its vision towards building capacity in healthcare, education, and I believe they are the biggest partners who've enabled us to have this session today. So welcome, Dr. Karan Rai.
Yeah, thank you. Good day, everyone. I'm just going to share my screen and share a brief presentation. Just going to talk a little bit about Project ECHO activities, especially in Africa. So just to give you a quick background, so in terms of Project ECHO's mission, so there's currently billions of people around the world that are suffering and dying every day from diseases that we already know how to manage, and it's basically an issue of access, the access to the right medical knowledge at the right time and at the right place. So Project Echo is a simple and scalable low-cost system that helps to address this crisis. So the idea is to build capacity throughout the healthcare system. And as I'll briefly talk about during the presentation, Echo has moved beyond healthcare, and we're working in a lot of other focus areas. So currently Echo is being used by a large global network, over 400 organizations around the world. We also, during the pandemic, we helped our partners to conduct many sessions for COVID-19, but overall, there's more than 70 disease areas that are currently being supported. The overall goal is to help touch 1 billion lives by 2025. And just briefly to talk about the COVID-19 activities. So during the pandemic, we've helped our partners to help train more than 600,000 healthcare professionals across 150 countries. More recently, over the last year or so, there's been a lot of effort supporting activities in the LMICs, particularly in Africa, Asia, and Latin America. And just to talk about the Echo model, so this is of course something that the participants will become very familiar with over the course of the programs. But just to briefly talk about the Echo model, so there's 4 key principles. That's using technology to leverage scarce resources, and it's essentially the use of video conferencing. That's one of the enablers to move knowledge instead of moving patients and or doctors. The second one is sharing of best practices, and everything at Echo has to be evidence-based, sharing the latest guidelines, etc. The third principle is, and this is an important one, mastering complexity through iterative guided practice and co-management of patient cases. So the idea is not to have passive learning just through didactics, but also to have people learn by presenting their own issues and challenges. And the fourth principle is measuring, reporting, and publishing of outcomes. So beyond just the knowledge that the programs are going well, ideally we do encourage participants, partners to think about evaluating and assessing the programs and understanding the larger impact. So overall, Echo is based on a collaborative model of all teach, all learn. So the idea is that all the participants learn from each other, whether they're the hub team, the so-called experts, or the rest of the participants. And Echo's goal overall is to move knowledge and not mission. So Echo is essentially a capacity building model. And as you'll also see, as you participate in Echo programs, we recommend a multidisciplinary team approach, and that's how the best capacity building happens. I also just wanted to mention over here that although Echo started out in the healthcare space for clinical medicine, so it was started by Dr. Sanjeev Arora for managing the crisis of hepatitis C in New Mexico. But as you can see, I've listed out over here non-clinical Echo programs, both in the healthcare domain and others, including we do have partners for running programs for patient safety as well. And the red ones are essentially non-healthcare. At the end, I've also just the last square, the last rectangle really indicates that partners are welcome to explore other focus areas as well. So briefly talking a bit about our replication activities in Africa. So this is not a comprehensive list. These are just some of the programs being supported by the Echo India team in Africa, but there are many other projects as well. So, but just to give you a brief idea, there's more than 30 projects that we're supporting across 15 countries. That includes under the larger ICANN project, we already have 5 hubs, including IPNet Kenya, which are currently running programs for infection prevention and control. So, and you can see the 5 countries are listed over here. And these are some of the ministries of health where we have formal MOUs with. So formal MOUs between Project Echo and the different ministries of health. So these are just some of them. So these are the ones where there's a formal document, but of course we're working across many other countries, and we are working with the ministries. And just to briefly show you, so we have large associations with Africa CDC. There's different projects across the different regions. This is the Southern Africa Regional ECHO. We're also supporting WHO, AFRO, and the headquarters in Geneva in a big way. So they're running many programs across Africa and global programs as well. So this is just one example of an IDSR program that was we helped support last year. And in terms of patient safety, so in August, there was a global consultation that was conducted by WHO, which the Project ECHO also helped support. So these are just some screenshots from that. And there was also a talk by the Director General of WHO. And just to summarize, so our goal overall is to help move knowledge instead of patients and providers. So we're really excited to be able to provide support for these projects. And I just like to acknowledge all of the stakeholders, and particularly IPNet Kenya and ICANN. And we welcome you all to the ECHO movement and look forward to supporting the launch of additional ECHO programs. Thank you.
Thank you very much, Dr. Karan Rai, and thank you for that wonderful presentation. And you can see you're really dedicated to improving and transforming healthcare education in the world globally. Thank you for that. Our next partner is from IPNet Kenya. Linus Ndegwa is the Program Manager, Infection Control at CDC. He's also the founder and leader of IPNet Kenya. IPNet stands for Infection Prevention Network Kenya. And he's an epidemiologist. And he wears many caps. And one other cap that I'll mention is the Vice Chair of the Global Antibiotic Resistance Program. Welcome, Linus, to make your remarks.
Good morning, everyone, and good afternoon. Thanks, Dr. Kaludu. Thanks for inviting me and all protocol observed. I want to really thank each and every one of us for attending this Patient Safety Day. One of the important aspects in the, for IPNet Kenya is really to help the healthcare workers be able to prevent infections occurring within their healthcare setup and to prevent new infections occurring to the patient. And IPNet Kenya has done quite a great deal in working together with other partners and the Ministry of Health, as some of them has been alluded to. But the most critical thing for us as IPNet Kenya is really educating the healthcare workers on issues about infection prevention and control, and building capacity on antimicrobial resistance, so that we are able to set up healthcare associated infection surveillance within our setup and within the ministry. Infection prevention Kenya has really been a platform where it brings about healthcare workers within this country and in the region to share knowledge. And so far, we've been able to organize several conferences which occur every year. And this year, we'll be having one conference whereby the infection prevention activities and sharing of knowledge will be done towards the end of the year in November. So we want to say that one of the key activities is really to help the healthcare workers be able to have skills that can be used to prevent infection occurring when, especially on day like this, when mothers are coming to the hospitals, babies are being brought to the hospitals, they don't go back to their homes with a new infection, but they are supported and treated of the conditions that they had. So infection prevention is, as you said, is a network and works with a number of organizations and works with across all the various groups, including all the healthcare workers and other industries that are more focused in preventing infections within the healthcare setup. So with that, I want to say thank you and thanks for this opportunity. Back to you, Dr. Karud.
Thank you very much, Linus, and thank you for the great work that you're doing with IFNET and in CDC. Our next partner is from CDC, Dr. Mark Bultras. I hope I pronounced your name correctly. Dr. Mark Bultras is the CDC Country Director in Kenya, and prior to this role, he was the team lead of Global Hepatitis Program in the HIV and Hepatitis Department at the World Health Organization. Welcome, Dr. Mark, for your remarks.
Thank you so much. I hope you can all hear me. I've turned on the camera. I hope that works for a little while. So good morning, Chief Administrative Secretary, Dr. Rashid Aman, distinguished colleagues from the Ministry of Health, Kenyatta National Hospital, and really all the development partners that are present, including WHO and the other programs, all protocol observed. It is my pleasure to be with you today on this World Patient Safety Day. It is an area that is very close and dear to my heart. As you mentioned, I spent quite a bit of time also working at WHO in Geneva as the leader of the Global Hepatitis Program. And of course, that's an area that's extremely affected by injection and generally healthcare safety. I'm happy to come also immediately after Dr. Linus Ndegwa on our staff, who has played truly a critical role in trainings here in Kenya in this area. As you know, each year a new team is selected to shed light in the area of patient safety, where action is needed to reduce avoidable harm and improve health outcomes. Let me turn the computer off here, sorry, it's making noise. This year's team, Safe Maternal and Newborn Care, with the slogan, Act Now for Safe and Respectful Childbirth. It is quite unique, especially because of the risks and harms that women and newborns have faced during this ongoing COVID-19 pandemic. The risks women face during childbirth are many, and you're all very aware of this, but they include the disruption of essential health services, the availability of infection control supplies, the inadequate infection control skills that often exist, and also the presence of antimicrobial resistance in many of the hospitals. The US Centers for Disease Control, CDC, in collaboration with the Kenya Ministry of Health, has been working hard to help address some of these issues to ensure safer maternal and newborn care. Some of the activities we support include supporting the ministry in establishing patient and healthcare worker safety department. Dr. Linus Ndegwa has been closely involved in that. Developing some of the technical guidelines, policies on infection control, antimicrobial resistance, and injection safety. We have supported the Ministry of Health also in developing the relevant COVID-19 guidelines, including home-based care for patients with suspected COVID-19, the infection prevention and control considerations for different stakeholders in the context of COVID-19, and guidance and recommendations on medical care waste management, just to mention a few of the guidelines. We've assisted also with the training curriculum to improve the skills of healthcare workers on infection control practices. And we've helped with a nationwide facility assessment of 877 level 4 and above healthcare facilities to gauge IPC practices and identify gaps for action. We've also helped with the training of over 4,000 healthcare workers in collaboration with our various partners. And I especially thank also the ECHO program in the assistance on the training programs here in Kenya. I am pleased that the ministry will be launching some documents today that will help guide to ensure safe maternal and newborn care. I'm also pleased that our technical teams have contributed to these documents in collaboration with the ministry and other partners. From the beginning of this COVID-19 pandemic, we have faced altogether many challenges, including disruption of essential services. Key among this is the maternal newborn child health services, and infection of healthcare workers themselves, and even quite high, unfortunate mortality among our healthcare workers in the Kenya setting. There has also been severe shortage of personnel and personal protective equipment for the personnel and some other IPC commodities. CDC and also US government more broadly has provided significant support to the national and county level COVID-19 responses, which has contributed to improvements in patient safety. We've provided technical support at the national level through the National Task Force and multiple of its subcommittees. We have helped with surveillance data for the response and paid for the establishment of 17 emergency operations centers at 17 of the major counties in Kenya, as well as an EOC system within the national prison system. We've helped with strengthening lab capacity for diagnosis and are also doing genetic sequencing for COVID-19 with substantial numbers. We're now at many hundreds of sequences that have been done here in Kenya. Strengthening infection control practices at the facility level, providing training to healthcare workers to ensure they remain safe, and then technical support now for the scale-up of the COVID-19 vaccine. Truly, the way to get out of this pandemic is through getting the majority of people vaccinated. US government is donating several million doses of vaccines. Actually, another 1 million doses of the Pfizer vaccine are arriving this afternoon at the airport, 2 p.m. And CS Kagwe will also be there for this other donation. But there have been multiple of these arrivals, a plane full, really a full plane load of vaccines that have been arriving over the last 2 weeks. And another one is arriving next week. And I know many other countries are also contributing vaccines. CDC has also supported specific programs for vulnerable populations, including people living with HIV. This support, which we receive ourselves through the PEPFAR program, has also helped to prevent mother-to-child transmission of HIV, working closely with the NASCOP program. Say a word also about viral hepatitis. Global data on viral hepatitis B and C shows that only 10% of chronic hepatitis B infections and about 21% of hepatitis C infections worldwide have been diagnosed. And few of these are actually on the appropriate treatment. So there's tremendous efforts that are still needed to improve on this situation, including also here in Kenya. From my time at WHO headquarters, I just wanted to mention a couple of things. Pakistan is among the countries that have the worst situation with hepatitis globally, because they have reuse of injection devices on a routine basis. This has caused large outbreaks of pediatric HIV infections, even just very recently, outbreak of over 600 children just in 2019, as well as the highest hepatitis C prevalence in the world with about 12 million people infected. That is a kind of situation you absolutely want to avoid. Luckily, we're in a better situation here in Kenya. Worldwide though, women receive many more injections than men do. And some of these injections are not really critical. They could be avoided. Further efforts are needed worldwide and also here in Kenya to eliminate all unsafe injections in healthcare settings. In Kenya, we would like to see the scenario improved as we continue supporting injection safety activities and the Kenya Infection Control Global Collaboration for Advancement, which is called KINGA, to ensure improved diagnosis and treatment of hepatitis B and hepatitis C. Additionally, TB, as you're all aware, TB case finding has progressively declined during the COVID-19 pandemic, highlighting the urgent need for measures to ensure healthcare workers' safety for optimized diagnosis and treatment to prevent the loss of TB control gains made in Kenya over the last several decades. So patient safety really starts with safe healthcare workers. Thus, CDC has supported measures to keep healthcare workers safe, including carrying out a study on the risk factors associated with their COVID-19 exposures and infections. CDC, working closely with the ministry, has played a critical role in the development of the occupational health and safety guidelines and training materials that go a long way in ensuring that the Ministry of Health, that together with Ministry of Health, there's a clear understanding on the implementation of worker safety programs. One area to stress also is that really every healthcare worker should be vaccinated with the COVID-19 vaccine right now, and also should have access to vaccines against influenza, hepatitis B, and others. Those are really critical to keep a safe healthcare worker program. Again, thank you very much for inviting me to participate in this important World Patient Safety Day. It's an important event, and I greatly look forward to our continued collaboration with the Ministry of Health and with all of you present here today, so that we can all together ensure that every patient receives high quality care. Kidole kimoja hakivunji chawa. Emphasize the teamwork that is really needed. Thank you all.
Thank you very much, Dr. Mark Bultres, for that wonderful speech. And it's true, kidole kimoja hakivunji chawa. Thank you very much for that. Our next partner is from World Health Organization, Dr. Joyce Onsongo. She'll make her remarks on behalf of the World Health Organization. She's the Disease Prevention and Control Officer in the Kenyan Country Office. She's also the lead. She also leads the case management pillar for the COVID-19 incident management team. Karibu sana, Dr. Joyce Onsongo.
Thank you very much. You can hear me. Can you hear me?
Yes, we can hear you. Yes, we can hear you.
I am. Thank you very much, Dr. Kalondu, and good morning. Let me take this time to recognize all the dignitaries who are here and all the participants. There is the Cas Rashid Aman, the representative of the DG's office who's here. That's Dr. Soti. We have the department representative and partners, the KNH, MTAPS. We have CDC country director, which has spoken, IPNAT, all participants, invited guests. Good morning to you all. As you've heard, my name is Joyce Onsongo, Dr. Joyce Onsongo. I'm here really to represent the World Health Organization. Myself, on my own capacity, I lead, as you heard, the COVID response pillar on the case management IPC in the country office team. But also my broad area really is disease control and prevention as the advisor to the country office. So let me allow me to read these remarks on behalf of the World Health Organization. On behalf of WHO Kenya, a representative, Dr. Juliet Nabionga, who actually is in Naivasha today, she couldn't be here. And on behalf of the Tanzania World Health Organization fraternity, WHO is pleased to join Kenya in commemorating this third World Patient Safety Day 2021. We take this early opportunity to commend the country for recognizing the day and organizing this high-level launch, as you have had a very, very informative brief, even from Evelyn and all the speakers who have gone ahead. World Patient Safety Day was really established as in 2019 by the 72nd World Health Assembly. The day is firmly grounded in the fundamental principle of medicine, that is first, do no harm. The World Patient Safety Day therefore builds a series of successful annual global ministerial summits on patient safety, which began in London, we know in 2016-17, respectively. And the overall objective of the day is to enhance global understanding of patient safety, increase public engagement, healthcare safety, promote global action, and to prevent, reduce the avoidable harm, as we have been hearing this whole presentation. Patient safety is a framework of organized activity that creates cultures, processes, procedures, behaviors, technologies, and environments with the community to consistently sustain sustainable lower risk, reduce the occurrence of avoidable harm, as I said, and make areas less likely to reduce the impact of harm where it does occur in our settings. Indeed, the theme of this World Patient Safety Day 2021 is safe maternal and newborn care. Due to the significant burden of risks and harm, women and newborns are exposed, especially when receiving unsafe care during the childbirth. Despite the significant progress made in reducing maternal and neonatal mortality, the Sustainable Development Goal 3 targets is still far from being achieved. The issue has been really compounded, especially on this COVID-19 pandemic, as we have already heard, which has led to the disruption of essential services due to the breaks in supply chain and women's inability to access care and the shortage of skilled health professionals. Even before the pandemic, approximately about 810 women and 6,000 newborns died daily with the tiny. Can you hear me? Sorry, somebody's interfering. With causes occurring mainly around the time of childbirth. Most of the deaths of stillbirths are avoidable through the provision of safe and quality care, skilled healthcare professionals working in a supportive environment, since maternity care is also affected by issues of gender and violence against women during childbirth have been pointed out as earlier. We need to empower this to reduce the trauma on them. Let me just quickly go what WHO has done as I conclude, as I highlight these areas. Under the COVID response pandemic, World Health Organization has done, I will just highlight what we have done in matters of response. Over $10 million have been put in various areas. WHO has, as you know, from the global level, put together response strategies right from our DG, Dr. Tedros, all the way to the regional office, Dr. Moiti, and also at our country offices to make sure that the response is really coordinated. We have expressed support of technical and commodities. In the country office, we have a specific team we call the IMT, where, as I said, I lead one of the team, which has looked at supporting the national response in 17 working groups of response. And I don't have to highlight all of them. But for this particular one that concerns us today, the IPC case management, where I support, we have been able to train over 8,000 healthcare workers with the team that is here. We have been able to provide personal protective equipment, case management equipment, IPC supply materials, and also just recently, as the team has already highlighted, initiated the development of the policy, health workers and patient safety policy and the quality of care. This is one of the things that WHO has done, which is in the region that is very different from other countries. And I want to commend the team for that. Now, with response to the maternal health, what has WHO done? Improving maternal health is one of WHO's key priorities. And WHO works to contribute to the reduction of mortality, of maternal mortality, and increasing evidence providing based on clinical pragmatic evidence and the standards and of member states. As defined in the Ending Preventable Maternal Mortality Strategy, WHO has worked just 5 areas I can highlight: addressing the inequalities in access to quality of reproductive maternal newborn health, ensuring universal coverage of comprehensive reproductive maternal health, addressing causes of maternal mortality and maternal morbidities and related disabilities, strengthening health systems to collect high quality data and to respond to the priorities for women and girls, and ensuring accountability in order to improve equity. So these are very high areas. And with regards to the newborns, WHO has also highlighted key areas that we are supporting countries, strengthening to invest in primary care around childbirth, improving the quality of maternal newborn, expanding the quality of services of the sick newborns, and including strengthening neonatal nursing, and promoting engagement of empowering mothers and families and communities to participate in the demand for newborn care. So there are many, many strategies that WHO has done. As I come to the conclusion, I conclude by saying that along this year's theme, safe maternal newborn care, we wish to take a special recognition of the efforts that Kenya has made towards achieving the maternal and newborn care, specifically adaptation of the maternal newborn quality of care standards and the ongoing Kenya adaptation of the standards of care for small and sick newborn. This is a key milestone towards the safety. These standards are aimed at ensuring every mother, every newborn receives quality of care. And WHO reiterates our continued support in expanding in these areas. WHO therefore wish to appeal to stakeholders and all partners here and to support government to continue these actions to ensure that respective childbirth is achieved. It is envisaged that the momentum generated by World Patient Safety Day will revamp these efforts to achieve the universal health coverage for all women, all newborns, and ultimately the maternal and newborns SDG target 3 may be achieved towards this Global Patient Action Plan 2030. So with these few remarks, I wish to commend you all and thank you for your attention. Bye.
Thank you very much, Dr. Joyce Nsongo. And just before I hand over back to our moderator, Dr. Irungu, allow me to thank the partners who were not here, who've not given their speech, that is MTRH, PSK, Farm Access, the media, and the county governments. You're all represented and we appreciate you for your efforts. Back to Dr. Irungu.
Thank you so much, Dr. Kalondu, and all the presenters who have effectively done their presentation earlier on. Next presentation will be from the MTRH, that is Moi Teaching and Referral Hospital, who will share their success story in as far as patient safety is concerned. So most welcome, MTRH. It's not indicated who will do the presentation, but you are most welcome.
Some questions, some of the people who are very
Good morning.
Good morning.
Good morning.
Yes, Dr. Morgan here. I hope everybody can get me.
Yes, you are loud and clear.
Okay, thank you very much for the opportunity to briefly share about our experiences here in MTRH. We are very much happy and privileged that today we part of the hosts for this International Patient Safety Day. And you've given us a chance to share our success stories. But even behind success, there are also failures. And I want to introduce myself briefly. My name is Dr. Morgan Richard. I'm an obstetrician gynecologist, a senior medical specialist. I'm also the Deputy Director, Reproductive Health. And also I'm the Head of Department, Fetal-Maternal Medicine. I was asked to do a reflection on what has been happening in the department for a number of years, geared towards patient safety. Around 10, 15 years ago, in our hospital, we had a very small maternal unit, a labor ward, which had just one bed. And this was serving, referrals from across 23 counties in the western part of the country. And this was because apart from, limited number of personnel handling these women, we had also pressure of space in terms of taking care of the women. We suffered a lot in terms of maternal mortalities, which were very high as, experiencing, 23 maternal mortalities per month. And over the years, we've seen a reduction of this because we sat down and started reflecting. Apart from the institutional and infrastructural aspects which have been done by the hospital through the support of the government, we've had serious process issues which have been addressed by ourselves in the department and in the division, which we feel that we can share with you. So during those days, we had serious challenges in terms of even getting the highly qualified personnel participate in patient management. And there were serious difficulties in terms of communication and even incidents. Adverse events were a challenge in terms of documentation and in terms of addressing them, because everything was geared towards, what sounded like victimization. And we've put a number of aspects together over the years to address some of the issues which came out over the years in using different models, especially inadequate training and the supervision of clinical staff, absence of protocols, all policy, all failure to implement the few policies which were then being done by the government itself. And we had challenges in terms of inadequate communication or reporting. And those of you who are involved in maternal care, you well fast with the 3 delay model. And we realized that despite patients being referred to our facility, there were delays in terms of providing care. And there were also, we had issues to do with the supplies, defective equipment, and even unavailable equipment. In fact, especially HDU ICU was an issue because of the kind of patients we could receive at that time, and the inadequate functioning of hospital services because of funding at that time. And of course, issue affecting our healthcare system, that is staffing. So as time came by, we realized that a number of women were dying because of some of the things that I have mentioned. And therefore, the very first aspect that I remember in our department, we had serious issues of communication. A consultant can do a word round, give their opinions about the patient management. Another one comes, overturns what was said by the other one. And in the end, it could leave patients, implementing or executing officer, including the younger doctors, confused. So we embarked on a process of doing protocols for the common conditions which were killing women. And this was also arising from maternal mortality audits, which were giving us what aspects where we failed. So since then, we've done more than 45 protocols in the department. These protocols are evidence-based protocols which take into consideration our, the resources available and the challenges that we face directly. And I can say this has really helped us in terms of addressing maternal mortalities and the neonatal outcomes. On top of this, around 2009 to 2011, there was a partnership project from FIGO, which was involving midwives, all partnerships in terms of those who provide care to women. And this was criterion-based clinical audit. This criterion-based clinical audit is non-victimization way of trying to see whether we adhere to some bare minimums in terms of providing care to women. And I wish to report and indicate here that this also has come a long way in terms of identifying the gaps which lead to, which lead to adverse events, which finally lead to maternal mortalities. And the good news about criterion of clinical-based audit is that at the end of it, it leads to improvement of care. And we have put together mechanisms on how to engage management so that it addresses some of the recommendations arising from the audit team. In fact, I need to say that the hospital has gone ahead and created a full department on clinical audit, led by nurses and partly midwives who look at advanced events and identify some of the issues on terms of compliance, especially arising from the protocols that we have done. I also need to say that we've also had 24 maternal audits. And this is, this is part of one of the protocols which we are embracing out of the 45 protocols that we have done. We have also done the hospital as a full unit of patient safety, out of which we've done a policy. And from the unit, we've also had, they continuously do root cause analysis on any adverse event which has happened to the patient. And adverse event here might not necessarily be a maternal death, but it includes any near miss, any complaints sometimes raised by patients if they feel that they have not received the kind of care that they desired. And the department has done well. And it has analyzed a number of events, adverse events, and came up with some key observations, which includes that the errors which were identified in terms of patient management were recurrent in nature. And especially, one of them is documentation, which is a big issue. And they also noticed that for, many reasons, especially for referral hospital, there is delayed intervention. And this is due to the competition of the existing resources. Like I said before, we are serving 23 counties. And, every mother who needs ICU will definitely be referred to MTRH, for instance. There are also staff issues, supplies and resources, and the knowledge gaps, which we have worked to address in terms of, trainings, emergency obstetric care. Initially, we had what we used to call advanced labor management course, ALAM, which people were trained and equipped with the skills. And we've had refresher courses since then to allow us meet the needs of the women. We've also noticed about late referrals. In the department, we've created a unit on outreach, and this unit goes to the various counties where the issue is, sits down with them. They discuss about what could be done about future management of such kind of patients. And we also noticed that the other issues which lead to these adverse events are non-ANC related. And sometimes they are not picked, like, abuse of patients, abuse of domestic violence and other kind of issues. So we now have the challenge of COVID-19, and the COVID-19 has really hit us in a number of ways. And this is because of, pressure of space. I didn't indicate earlier that we do conduct around 1,200 to 1,500 deliveries per month, which translates to, like 50 deliveries per day. So because of this, we've come up with an enhanced postoperative recovery protocol where women are discharged very early from the wards, but we keep track of them in case of any complications, and they are given our hospital contact so that they can reach us. And we are happy. Sometimes back, we had the Red Cross who offered, during the curfew times, they offered a way of, transportation of women to the hospital during curfew hours. And because of this, we now discharging patients very early. This is against what exists in our maternal guidelines, that women should spend in the hospital at least 24 hours for postpartum observation. But we've been forced to do this because, if possible, we need one woman, one bed at the very least. But this has been a very big challenge because of the number of deliveries we have. Sometimes our bed occupancy is more than 150%, even up to 200%. And therefore, we are forced to make some decisions for purposes of safety of patients, especially in terms of early discharge. We have got a 24-hour discharge system, which allows a woman even to be discharged at night, so that we are able to also partly prevent our patients from COVID-19. I wish to report here that due to the various interventions put in place, all geared towards patient safety and towards addressing a number of adverse events that we have witnessed over the years, our maternal mortality our institutional maternal mortality, control for the factors that we are able to take care of within the hospital, has reduced quite significantly. And now we are talking about 0.19%. We were at 0.25% as early as 2010. And we are very much grateful for the support that we've had from the institution. More important, on institutionalization of patient safety in the hospital, especially having it as a full unit which continuously analyzes advanced events and even sometimes fatal events, including maternal mortalities. Thank you very much.
Thank you so much, Dr. Mogeni, for that detailed journey on matters patient safety at the Moi Teaching and Referral Hospital. Thank you so much. At this point, I want to recognize the presence of our Chief Administrative Secretary, Dr. Rashid Aman, and for that matter, we'll briefly change the agenda to remarks and official lounge. And I wish to call upon Dr. Simon Kibias, the Directorate of Health Standards, Quality Assurance and Regulations, to take up the next steps. Karibu, Dr. Kibias.
Thank you, Dr. Irungu. Our Chief Administrative Secretary, Dr. Rashid Haman. All protocols observed. Good morning. It's a very important day for us here in Kenya, and I believe globally, but when you're observing this World Patient Safety Day, the 17th day of September 2021. I think I really would like to appreciate those who have spoken before me and the guests, those who have been invited into this occasion. I really appreciate the partners who have put together all the resources to ensure that this day is a success. We also take cognizance of the fact that there's a lot that has been done to ensure that patient safety is observed at our point of service delivery, and we say thank you to those who are involved. I think before we say more, I think I would request the head division of reproductive health of maternal health, if he's here, to give remarks before we proceed with the rest of the agenda.
Dr. Simon.
Yes.
My name is Dr. Kitonga, representing Dr. Kaliti at the end of reproductive and maternal health. I'm the maternal health program manager in the division. So yes. On behalf of Dr. Kaliti, I would like to say that as a division, it's the division that is technical division of the Ministry on Matters of Maternal and Reproductive Health. We have, with all protocols observed, we feel privileged that the patient safety fraternity chose this year's theme as safe maternal and newborn care. We as a division, this is safety services, safety and quality services to mothers and newborn has been our priority. We have been working with stakeholders and the counties who are the service providers to ensure that the services for mothers and newborn are safe. We have developed protocols and guidelines that are meant to ensure that these services are given in a safe environment. We have also developed training packages. We realize that if we have to have safe services, we need minimize errors and injuries. And this can be done by continuing skills development for the service provider. So we have developed training packages, also mentorship packages. This year, we have revised the quality obstetric and perinatal care guidelines that will be launched soon. We as a country also adopted the WHO quality, maternal and newborn quality standards. These were 8, but we as a country added 3 more, especially on obstetrics, surgery, and anesthesia, and community involvement. These are the standards that ensure that we do the same. All the caregiving is standardized across the country so that we minimize errors and injuries. Last year, when the COVID came, one of the services that were initially interrupted was the maternal and newborn services. However, the ministry, through the division, came up with the reproductive and maternal and newborn COVID-19 guidelines. These are the guidelines that are meant to ensure that there's continuity of service while ensuring that mothers and newborns and the service care providers are safe. The counties, the partners, ensuring these guidelines and the technical assistance are given so that as these And these guidelines keep on being updated as new evidence comes on this COVID-19. We have priority areas we have focused as a department. That is to ensure there's safety. We have ensured that there's access to skill deliveries. We and support from the highest level of our leadership through the Leader Mama program. This is a program that ensured this proportion of mothers who are delivering underskilled this from below 60 to current 78.3%. The other area we are focusing is improvement of quality of care. Access alone is not enough. We have to ensure that people who access quality care. We have said we have developed those protocols and guidelines. The other area we are focusing is strengthening the commodity security. We have identified what we call life-saving commodities for mothers, together with also family planning commodities, to ensure that women plan they are enabled to plan their pregnancies so that they go through the pregnancy, and to ensure that the outcome of pregnancy is healthy mother, healthy baby, and happy family. So we continue working with the other departments of the ministry and the partners and the counties to ensure that the maternal and newborn health services in this country are safe. Thank you.
Thank you so much, Dr. I think it's quite in order to pick on maternal and child health because of this year's theme that emphasizes the need to act now for safe maternal and child newborn care. So we really are so grateful for the good job you're doing. We know the other service providers are doing their best to ensure that the patient safety is observed at the point of service delivery. We really acknowledge that. We acknowledge and appreciate and thank everyone within the health sector that has put in their effort to ensure that there is a high quality of maternal and child health care in our country. Thank you so much. And at this point, ladies and gentlemen, I think it's opportune time. It's my ample pleasure also to invite our chief guest, the Chief Administrative Secretary, Dr. Rashid Aman, to take the podium and give his remarks, and thereafter preside over launch of various very important documents that will contribute towards the health system strengthening in our country. Thank you.
Thank you very much, Dr. Kibias. I hope I am audible to everyone.
Yes, you are.
You can hear me. Okay.
Yes.
Thank you. Good morning and a warm welcome to all of you attending this commemoration of this year's World Patient Safety Day. This year's theme is Safe Maternal and Newborn Care. This is of vital importance and comes at a time when the government is striving to contain the COVID-19 pandemic through ensuring that a critical mass of Kenyans is vaccinated, and with special emphasis on pregnant and breastfeeding women. This pandemic has unveiled the huge challenges and risks patients and health workers are facing globally, including healthcare-associated infections, violence, stigma, psychological and emotional disturbances, illness, and even death. This event is timely because of the concern about the safety of pregnant and breastfeeding women with the ongoing COVID-19 vaccination process. Ladies and gentlemen, the state is obligated to observe, respect, protect, and promote the well-being of all women of childbearing age and support safe and respectful care. We are sadly alive to the fact that many women have lost their lives as they tried to bring another life another to life. This, in essence, makes maternal care a fundamental cornerstone of our health service. And this event today is an excellent opportunity to reflect on progress, consider challenges, and put together how we can deliver safe, effective care where good quality patient outcomes are our primary focus as we scale up universal health coverage. Healthcare systems are complex, predisposing patients to harm during the provision of care. Patient safety aims to prevent and reduce risks, minimize errors and harm that occur to patients while seeking care. This year, the World Health Organization urges healthcare workers and other stakeholders to act now for safe and respectful childbirth, with the theme, Safe Maternal and Newborn Care. According to WHO report of 2020, approximately 810 women die every day from preventable causes related to pregnancy and childbirth. In addition, globally, around 6,700 newborns die every day. It is estimated that about 2 million babies are stillborn every year, with over 40% occurring during labor. The burden of unsafe care has exploded. Disability, and in extreme circumstances, death. The majority of stillbirths and maternal and newborn deaths are avoidable by providing safe and quality care by skilled health professionals working in a supportive environment. To create an enabling environment, stakeholder engagement, robust leadership, and the adoption of policies can lead to better outcomes. During this year's World Patient Safety Day, the Ministry of Health seeks to enhance patient safety understanding, highlight areas of success and opportunities for improvement, and engage frontline caregivers in providing safe maternal and newborn care. Safe maternal and perinatal care aims at ensuring all women receive the care they need to be safe and healthy throughout pregnancy and childbirth and during the postpartum period. Timely management by a skilled birth attendant working in a supportive environment helps to prevent most maternal morbidities and mortalities and promotes safety, health, and well-being of mothers. Ending all preventable maternal deaths by the year 2030 is a commitment Kenya made during the ICPD 25 conference held in Nairobi. Over the past years, Kenya has made remarkable progress in improving maternal health outcomes. Maternal mortality ratio has declined from 488 per 100,000 live births in 2008 to 362 per 100,000 live births in 2014. Child mortality rates in Kenya have also declined over the last decade. However, the slowest decline has been in neonatal deaths. Between 2003 and 2014, Kenya's under 5 mortality rate decreased by 55% and the infant mortality rate by 49%. The slowest decline was in neonatal mortality rate at 33%. These achievements were realized because of key government and stakeholder initiatives. One of these initiatives aimed at improved access to skilled birth attendants is the Linda Mama program, which was launched on 1st June 2013 by His Excellency President Uhuru Kenyatta as free maternity program and the rebrand as Linda Mama under NHIF in October 2016. The number of pregnant women accessing skilled deliveries increased from 65% in the year 2018-2019 to 78.5% in the year 2020-2021. Practices that improve quality of perinatal care, such as clean cord care, early breastfeeding, kangaroo mother care, among others, go a long way in transforming maternal and perinatal survival outcomes. Another key aspect of improving quality of care around the time of birth is empowering nurses and midwives to identify cues for complications and make informed decisions to address them. Constitution of Kenya 2010 and the Health Policy Framework 2014 to 2030 goal is to offer quality health that is responsive to the needs of the Kenyan populace. Quality care is core to achievement of universal health coverage and the Sustainable Development Goals. Poor quality of maternal and newborn health services remains a hindrance to achieving the SDGs and ending preventable maternal and newborn deaths. The Kenya Quality Model for Health recognizes that patient experience is critical and effort must be made to make this experience positive universally. KQMH model foresees maternity care being provided in a dignified and respectful manner, dressed in effective communication and founded on a bedrock of supportive healthcare as a basic human right. To address the quality of maternal and perinatal care, the Ministry of Health, through the Department of Standards, Regulations and Quality Assurance and Division of Reproductive and Maternal Health, have developed maternal newborn health standards for improving quality of care and maternal newborn health quality of care assessment tools in line with WHO standards for improving quality of maternal and newborn care in health facilities 2016. Following this development, Kenya has been registered into the Global Network for Improving Quality of Maternal, Newborn Healthcare, Quality, Equity, and Dignity. The application of quality management during childbirth can avert an estimated 30 to 45% of neonatal deaths and 25 to 62% of intrapartum stillbirths. The ministry has also revised the national guideline on quality obstetrics and perinatal care that will standardize evidence-based best practices, inform policy and advocacy in maternal, neonatal, and newborn health for individual and societal healthier outcomes in Kenya. The COVID-19 pandemic initially presented challenges in utilization of maternal health services in health facilities. To address this, the Ministry of Health has developed and disseminated RMNH COVID-19 national guidelines to guide the provision of maternal and neonatal health services and ensure continuity of services during this COVID-19 period. And we are comforted that the emergency maternity services have continued to be offered during this period of the pandemic. And efforts are coalescing across the country to ensure every pregnancy is duly attended to in a timely manner by a skilled healthcare giver, while ensuring safety of the clients and their health service providers. As I conclude, I would like to bring to your attention that the Ministry of Health, with the support of the USAID MTAPS project and the UK Fleming Fund, has revised the National Infection Prevention and Control Policy and Strategic Plan 2021-2025, developed a monitoring and evaluation framework for the National Action Plan on Antimicrobial Resistance, and a clinician's handbook on diagnostic stewardship to provide guidance to minimize and control the occurrence and spread of infections, enhance appropriate use of antimicrobial agents, thereby improving the overall safety and quality of healthcare service delivery to the population. As we mark the World Patient Safety Day, we take this opportunity to officially launch these key documents alongside the IPNET Kenya supported ECHO India virtual capacity building platform today in support of patient and health workers' safety. Finally, as a sign of our commitment to the process, the MOH is finalizing the patient health workers and quality of care policy and action plan, which will provide much needed on safety and quality with regards to healthcare delivery. For your kind attention, and I hope we join hands to act now for safe and respectful childbirth. Asanteni.
Thank you so much, Chief Administrative Secretary, for that beautiful speech. Let's all put our hands together. Thank you, and I think now it's the right time now to welcome the team preparing the launch of the documents that have been mentioned by our Chief Administrative Secretary. Kindly, Dr. Evelyn Wesangula and team, take over from here.
Thank you so much, Dr. Rashid, for those great remarks. For all on the call, give us one brief session to project the documents that we are officially launching.
Thank you, Irungu.
Just a few seconds.
It's fine. I think this wonderful team, you have the time to prepare. I think we kind of take this time to remind ourselves that all stakeholders have been urged to act now for safe and respectful childbirth. And the theme for this year's Patient Safety Day is Safe Maternal and Newborn Care. So I think from the Chief Administrative speech, we've seen all the good work being done by patriotic stakeholders within the health sector, and we really appreciate that. Thank you, and God bless. Fellow participants, I think earlier on we had scheduled the Director General for Health to speak before the chief guest, but apologies because of the technical hitch. Or I think his message may be posted in the social media of the Ministry of Health later. Thank you.
Okay, good morning.
Welcome, Dr. Evelyn Wesangula is the head of the Division of Patients and Health Worker Safety, a very vibrant and active unit within the Ministry of Health.
Okay, thank you
and
very much.
Welcome, Dr.
Thank you. I want to take this opportunity to appreciate the support that has been given to us by leadership. And during my initial presentation, I mentioned the importance of leadership and commitment to this cause. And over the last 3 years, we have seen consistent support from our leadership to support our efforts towards the patient safety initiatives. I want to take this opportunity to thank our Chief Administrative Secretary, Dr. Rashid Aman, for his unwavering support towards this initiative for the last 3 years. We cannot take that for granted. Supporting the work and also just reaffirming the importance of the issues that are at hand. I also want to thank Dr. Kibias, Simon Kibias, for his support even at the directorate level. And I just want to project the 4 documents that we are launching today, in addition to 2 other platforms that we are also launching as a show of support towards the patient safety efforts. So we have these strategic documents that we have prepared. One is the monitoring and evaluation framework for antimicrobial resistance to monitor the implementation of the National Action Plan on Antimicrobial Resistance. We've been implementing the National Action Plan for the last 4 years, and it's important for us to be able to evaluate the level of implementation and also assess progress made over the last 4 years. So with the support of the USAID MTAPs, we've been able to develop this document, which is critical. As we implement it, we are also going to be able to have very useful feedback in informing the next version of the National AMR Policy and Action Plan. Alongside the framework, we have also developed what we call the Clinician's Handbook for Diagnostic Stewardship to support clinical teams on appropriate use of microbiologic diagnostic tests, because as we implemented the action plan, we realized that we needed to build capacity for microbiology, not just for the laboratory teams, but also for the clinical teams that need to appropriately interpret the results that come back from the laboratory, and that is going to be useful in guiding their treatment options at the end of the day. So this has been supported by the UK Fleming Fund, and I know this is a critical tool to support the implementation of antimicrobial stewardship programs in our healthcare settings. The next set of documents that we are launching today are 2 documents supporting infection prevention and control. And these documents are different from the previous versions because in the previous versions, we didn't address a lot of outbreak response or community infection prevention and control. But in this version of the infection prevention control policy and strategic plan, because of the lessons that we have learned during the ongoing, with the ongoing pandemic, we deliberately included the response and preparedness from an infection prevention and control perspective to outbreaks in future. So we now have our 3rd edition of the Kenya National Infection Prevention and Control Strategic Plan to guide us on the next 5 years. And we also have the National IPC policy that will be in effect also for the next 5 years. The next set of platforms that we are also taking a lot of pride in today and launching alongside our strategic documents one, a virtual learning platform, which we are launching in collaboration with ECHO India, Infection Prevention and Control Kenya through the support of CDC, Infection Control Africa Network, and our partners ICAP, ITech, USAID, and Aga Khan University that have been really supportive as we have built capacity for healthcare workers virtually. This came in very handy in our response to COVID, the COVID-19 pandemic, when we didn't have adequate resources. We could not go to all the counties and reach all healthcare facilities at the same time. But through the virtual platforms that we had, we realized and we've learned that we can reach quite a lot and provide a lot of mentorship and coaching virtually. We have tested the virtual platform for the last 4 years, at least building capacity for IPC. And we are now taking this up at a national level to scale up the different initiatives that have come through and also just make use of the different curriculum that we have developed. So this platform will be jointly co-hosted by IPNET Kenya and the MOH with the support of ECHO India. And we also have an opportunity and a proud moment for the country to launch an extra or an additional support, an additional society championing for quality healthcare. Like we said at the beginning, as we develop our national policy on patient and health worker safety, we are also including quality of care in the policy. So I believe as we launch this society for quality healthcare today, the country level, we are going to use all these available platforms to build further capacity and also just solidify the efforts that are currently ongoing with respect to championing patient and health worker safety and quality of care initiatives in Kenya. So this is the end of the presentation. I know if we had a physical launch, we would have done what we always do, hand over the books. But as soon as we are done with our session today, all these documents are going to be uploaded on the MOH website and they will be accessible to all of us. I want to take this opportunity once again to thank our chief guest for honoring the call to come and launch this document, and the entire leadership at the Ministry of Health for supporting this course. And indeed, where there is commitment and leadership, I'm sure we're going to see a change at the end of the day. I also want to thank my colleagues from the division, the department and the directorate in general for their great commitment and support, even in the middle of all the challenges that we've had. So we keep soldiering on, and I'm sure at the end of the next year, we will be saying something different and on a positive note on that. Thank you very much. Over to you, Dr. Kibias, and back to the moderators for the day to usher us into the next session.
Dr. Kibias, you're still on? Thank you so much, Dr. Sangula, for at least giving us a preview. Oh, Dr. Kibias, we try to get to you. Dr. Sangula has presented the documents to be launched. So I was handing over back to you to close out on that session before we proceed.
Thank you, Dr. Irungu. Congratulations to everyone for all the beautiful job well done, culminating in the launch of those very important documents, frameworks that will go a long way in improving the quality of care in our health settings. I think it's a shot in the arm to have those documents at this time, even as we struggle with the pandemic. And I'm really so grateful with the team in the standards for having been very useful even during the pandemic, whereby we came up with guidance on COVID-19 pandemic and so on, and many other guidelines that have been developed with their support. Thank you also to our partners who've been very supportive. I think now with high time we move into the next item.
So thank you so much, Dr. Kibias, for running that session well. I think our next session is our panel discussion on patient safety. And at this point, I hand over to Dr. Lydia Okutoi, who will moderate that session. Dr.
Thank you very much. All protocol observed. Good afternoon, ladies and gentlemen. Thank you, Dr. Kibias and Dr. Wesangula and the CAS for this great occasion that has been enabled us to have advocacy for patient safety. As a country, we are proud that these efforts are able to get the highest recognition. And so we hope it will trickle down in terms of impact at the population level for every mother, every child, and every Kenyan who seeks care. My name is Dr. Lydia. I work for KNH and also the president of Society for Quality Healthcare. And we are glad of the mention for our launch also today. We're going to the panel discussion, and we will have PSK represented by Dr. Nyabero and COGS by Dr. Kireki, Midwives Association by Eunice, and Dr. James Gitonga. We welcome you again for MOH, and IPNET will also be there. Sandra from World Ribbon Alliance, I will also ask you that you be part of the this panel. And so as we have this time of emphasis, there are various questions that have been asked either at the level of healthcare providers or managers or at policy to all contribute towards this effort of quality and safety, and especially in reproductive health, maternal and newborn care. Allow us to have an introduction from those members shortly, especially for those who have not spoken, just for a minute. Dr. Kireki, kindly introduce yourself. Eunice, I don't know whether Kireki has dropped off. Eunice, I can see you are there.
Thank you so much, Dr. Lydia. My name is Eunice Matsali. I'm a representative for Midwives Association of Kenya in this session, and we are really honored to be part of the panel for this particular event, and especially because you are honoring safe maternal and newborn care, which is our key mandate as Midwives Association. So I'm honored, and on behalf of Midwives Association of Kenya, we are glad to be part of this panel. Thank you very much.
Thank you very much, Eunice. Indeed, midwifery is the hallmark. It's that they support this care on a continuous basis. We cannot do without you to ensure that mother and baby are safe. What about Nyabero from PSK? Kindly introduce yourself shortly.
Good morning. My name is Dr. Lucas Nyabero. I am a clinical pharmacist, and I am from PSK, and we are greatly honored to be requested to come and present. So thank you to everybody, and all protocols observed.
Thank you, Doc. Do we have James, Dr. Gitonga James?
Thank you, Dr. My name is Dr. James Gitonga from the Ministry of Health. I'm the program manager for maternal and newborn health in the Division of Reproductive and Maternal Health. Thank you.
Great. Is Linus representing IPNET again? Linus, are you there?
Thank you, Dr. I'm here, and good morning, everyone. It's Linus representing IPNET Kenya. Thanks.
Thank you very much. I don't know whether Dr. Kireki has logged back, but if not, we just had a few questions and insights on where we are as a country and what we can use to solidify commitment towards a common direction. I know in the previous speeches that has come out, but we'll just have some short interaction. We'll start from the patient-related experience. We are really good in the technical aspect, but how to make the patient experience care with dignity. We want to get some insights on the Kenyan landscape and the projects that White Ribbon Alliance have been doing. Sandra, are you there? You'll introduce yourself and go ahead and share some bit on respectful maternal care.
Thank you. I'll just introduce myself first. Hi, everyone. My name is Sandra Mwaranya. I am the Advocacy and Programs Lead with White Ribbon Alliance Kenya. And I'll ask if I could share some slides to really share some of the key quotes that we've gotten from patients, particularly mothers, regarding the maternal health. And thank you so much for inviting us to this platform on this commemorative day.
Thank you, Sandra. I think Eric, Dr. Irungu will help you give the capability. Great.
Okay, just let me know if you can see my screen. Just put it on.
Yeah, it's almost there.
Okay. There we go. Okay, can you see it?
Yes, we can see it, Sandra.
So I will just be speaking on the patient experience using the maternal health lens. White Ribbon Alliance, for those who have not met us before, we are a powerful network of advocates working for maternal, newborn, and adolescent health and rights at the local, national, and global levels. We usually mobilize citizens, in this case, women, mothers, girls, by helping them to recognize and seize their power to demand that all women and their children are safe, healthy before, during, and after pregnancy. And we have a very strong presence in Kenya. And that is going to be part of my, my presentation. Okay. So our focus is usually bringing the mother's voice and agency as part of the picture, as part of the agenda of maternal health, the safe and maternal health agenda. And as part of this, we were very keen on listening to what really the mothers have to say regarding, how they define quality maternal health as per their experiences. So we sought to create a campaign that was called the What Women Want campaign. And in Kenya, it was triggered by the confidential inquiry on maternal death report of 2018 that highlighted that the reason why our mothers are dying was a result of poor quality of care. In fact, 9 out of 10 women in this report died as a result of substandard care. So we sought to understand what does quality really mean to women and girls? How do we better understand the perspective, because this is truly a serious issue. So we went ahead and asked 120,000 women and girls in Kenya, 15 years and above, and this was part of a bigger group of women that we asked globally, to tell us what is that one request for quality reproductive and maternal health services. And ladies and gentlemen, the results were far beyond what you and me as health workers, as programmers, as policy makers understand as the definition of quality care. Their number one, just to note that out of the asks that we made, we were able to engage with 359 partners, and we're able to generate over 1 million demands from 114 countries. And the number one ask, as you can see, was respect and dignified care, where we actually received 103,000 responses from the women. And really unpacking what that meant was love and care to mothers. In fact, it was a very insightful experience. So we're able to see that, we had it loud and clear from the women that they want to be listened to. They want to have an interpersonal connection with the health providers. They did not want to be talked down to or judged. And as you can see, they want compassion as much as any other health outcome as the definition of quality care. And having how this respectful and dignified care was expressed by mothers was, they want to also be listened to. So listen to me. This is not their language. Make me feel welcome. Doctors must not laugh at a patient. And the nurses should not despise. And this was basically after probing them, because at the end of the day, we had that, yes, they want safe care, they want respectful care, but what does that really mean to you? And, this is very, even as we commemorate this day and we launch a lot of these documents on, what quality standards and quality safe maternal and newborn care looks like, it is important that we also see it from their perspective, because sometimes you can be lost in our language as health workers, as programmers, as policymakers, as financial experts, assuming that we figured it out, right? That we know for them, it is getting this very sophisticated maternal bed or maternal ward, or ensuring that, we have these high-level definitions of quality. But at the end of the day, when we talk about patient-centered, are we truly speaking to the experiences and to the needs and priorities of the clients that we work with, the women, the mothers, the girls? And as you can see for them, and this was really the number one demand, of course, we had many other requests, like the second one in Kenya was WASH, and they were asking about clean linen. And, for them, it's just they can go to a small health facility, but at least can they access clean linen? Can they access water in the toilets? Can they access water after bath? And for them, those are the definitions of quality. So, and that is something that we felt, okay, so now that we've said this, what next, right? How do we then ensure that these perspectives are reflected in such conversations, in such actions? And that is what we're currently engaged in as a movement. We are keen on listening to these demands and this priorities of the mothers by activating action agendas. And one of the things that we've gone ahead to do in Kenya is bringing health workers, particularly the midwives. And I'm happy to see Eunice Atsali and also Raheli earlier on, because they're also part of this, this agenda, where we really want to hear, what does respectful care also mean from the side of the health workers? The fourth demand from this campaign, actually, from the women and girls for what quality care means to them was they want to see better supported and increased midwives and nurses. And so they're also part of this conversation. And as we advance on this, acting now for this agenda, acting now for safe and respectful maternal and newborn care, it is important that we bring these voices together. This year, we spent some time listening to the midwives as well, on asking them, now that we've heard from mothers, can we hear from you as well? What are the key factors? What are the key issues that have emerged in your profession that you feel have barred you from actually delivering the respectful care that mothers are asking for? And we've already received some results and we'll be launching them next week. But the next point is, how do we then bring those voices together in dialogue? How can we get the health workers and the mothers and the women to actually interact and then create or influence what care looks like moving forward? And for us, that is what we call a collaborative approach, a multi-sector approach. It is just not one person's agenda, it is everyone's agenda. We are truly going to push the safe and respectful maternal health agenda. I will close now by just urging everyone on this platform that we need to listen. As we go ahead with our plans and our agendas, let us not forget the voices of those who matter, the users, the mothers, the women. Let us listen and act and be part of the revolution. If you want to find more details of, just the micro responses to what the mothers said, you can find them on our website, whatwomenwant.org, and you'll be able to really interact with some of those findings and actually see also what is happening across the world regarding this agenda. Thank you. Thank you. I'm done. I hand over to Dr. Ari.
Thank you very much, Sandra. That is quite some message information. They want the toilets clean, they want clean linen, and that is what we would want if we were in that position. I'll kindly remain on the panel then as we get insight from the others, in case any of the members here have any other question to Sandra, specific issues, you can type it on the chat box. Coming to the midwife and midwifery association, Eunice, from these findings, we realize that as a country, we are having the standards, but care has to be delivered with dignity. Where do you think we are? We experienced devolutions in 2013, and right now we continue being in many transitions. We got COVID, which brought strains and opportunities. Where do you think we are as a country? And what is the role of midwifery society in regard to this? Kindly, Eunice, take that question.
Okay, thank you, Lydia, for that question, and thank you, Sandra, for illuminating into the status of maternal newborn care within the country. Devolution has impacted, I think, both positively and negatively towards maternal newborn care, because some of the care, for example, we have gaps when it comes to capacity building. So for example, if I'm in a county that is having support, like international support, when it comes to capacity building in something like newborn care or essential birth care, EMOC, then I'm advantaged if I have such support. But then when it comes to some counties that do not have such support, then it reduces the chances of midwives in this area getting capacity building. The positive aspect about devolution when it comes to maternal newborn care has been, according to us, is, well, we are able to employ or to identify the gaps, for example, within a country. If you need healthcare workers, especially midwives, in maternal newborn care areas, then it's possible to be able to evaluate within the county how many midwives are required for a particular region and be able to support them effectively. However, a lot has to be done, and especially when it comes to
Dr. Njagi, kindly mute. Jacinta. Eunice, we can't hear you. Are we able to hear Eunice? I think lost Eunice. She will rejoin. I think in the same breath, Dr. Gitonga, kindly comment about the same topic that Eunice was sharing, what has happened in regard to care through devolution and through COVID, and then also comment something about human resource for health. As part of this action plan, part of the action points for emphasis of these days, having healthcare workers engaged and skilled, motivated healthcare providers for maternal and newborn care is important. So please kindly give a comment in regards to the human resource for health with regard to maternal and child care.
Thank you, Dr. I hope I'm audible.
Yes, we can hear you.
As has been said, evolution brought both positive and, to a certain extent, some negative aspects as far as care, maternal and newborn care is concerned. But I think the positive side outweighs the negative. We have seen increase in access to the services. County governments have all over the country put up new facilities. We have more CMOC facilities and also more BMOX facilities. Then we have seen some increase in recruitments from various counties that has gone into improving the human resource for health. However, devolution has also presented with some challenges, especially on the management of human resource for health. There have been teething problems. Some counties were not well facilitated in addressing human resource issues. We have seen frequent interstitial unrest from one county to another. This has impacted negatively on the service delivery. We have seen prolonged strikes, and most of the people who suffer are the mothers and newborns when these services are distracted. But we are working with the counties to capacity build the HR department of the counties so that they can be able to engage with the union of the health care providers so that they don't result in industrial unrest. The other thing is the ministry has also supported the counties with some secondment or recruitment of staff, especially as the US program, Universal Health Program. This is supposed to increase the numbers that are offering, especially at the primary level delivery points. We need to have adequate staff, especially and delivery. You know, if the safety is to be ensured, at least there should be at least 2 service providers, especially when the woman is in second stage, so that one can give attention to the mother and the other one to the baby. Especially the first 1 minute, the golden minute means a lot to the survival of the baby. We are also been trying to work with the counties to build the capacity of these healthcare providers so that they have the up-to-date skills, so that they are able to offer quality services. We have, as the guest of honor said, we have the guidelines, the MNH quality guidelines, and some of these things are addressed there, the staffing, they need to have adequate staff, adequate motivated staff, and all these things are in the guidelines that are supposed to guide the counties.
Thank you very much, Daktari. Indeed, the evolution gave us opportunities and challenges, but we had to work through them to ensure that every mother and baby is safe. And just learning and reflecting from our outcomes as a country is really important. Dr. Wesangula mentioned of important kits, and also I think it came from yourself, from Dr. Gitonga, about the cardinal or essential medications for the labor wards. I think from PSK would just ask them to give us some insights on their contribution towards those essential medications. I remember there was a time we had challenges with the quality of oxytocin. Nowadays, we don't hear much of that, but they are still very important signal drugs, which any facility offering emergency obstetric care would have. Kindly, Tito, could you mute? Dr. Nyabero from PSK, kindly give your remarks with regard to your support for maternal and newborn care.
Sorry, I was talking to myself. So I'll start from before I get to the quality of the medications that are coming in, which I will address. I also wanted to mention something that has been missing, or rather needs to be highlighted, is that every mother, every woman, prior to conception, the body has to be ready. So there is supplementation, there's medications. All women, some of them maybe have chronic conditions and management, and those medications that they use could influence whether you get pregnant or not. Well, once you get pregnant again, the chronic conditions don't go away, and they'll carry you through the whole term and even on the other side of it. So this is where pharmacists' knowledge and pharmacists' care in terms of maternal care will be very important. Some of those medications will predispose the moms to injury, to predispose the mom to conditions that they could have actually been avoided. And this is exactly where pharmacists, knowledgeable pharmacists, and this is where the contribution, our biggest contribution, is the knowledge that we have of how these medications interact with the body, with the baby, with the mother, with lactation, with even just the regular hormonal predisposition to conception or lack thereof, to carry the baby to term and all those things. And I think one of the things that it's not been highlighted in the presentations to date, to this moment, is that particular portion of it. A lot of us are on medications. A lot of us go over the counter and buy medications. There's movements to change on how medications are available over the counter, but then we do not look at what is the effects on the child and maternal health. That being said, the quality of medications that are coming into the country, there are a few moves that have been done, a few policies and a few other practical steps that have been taken to make sure that some of the medications that are coming in, the allowance, which medications, who's selling medications in the country, systems on how to monitor the pedigree, where the medications come from, the effectiveness of medications. But this all is all a part of communication. Once you understand that a particular brand of medication is not working the way it should, then I think the chain of communication is very important to ensure that that information gets back to the regulators and make sure to see what is actually the problem with this particular medication. So communication is very important. Side effects, and both the PPB and PSK have systems where you can report medications that don't work as well as they should. Over back to you.
Thank you very much. Dr. Nyabero, you brought an important aspect of even optimizing the patients before they conceive. We had a roundtable discussion in Kenyatta with our labor ward staff and the antenatal, postnatal wards. And we realized we've been having some outcomes with regard to patients with chronic illnesses, like you get a cardiac patient in pregnancy or with other chronic illnesses. And so the idea is to optimize them before they get pregnant. I know that is not a common concept culturally, but I think where we have reached, because we are having more of the people with chronic illness getting into childbearing age, it's very important that for safe, respectful maternal care, we also look at preconception issues. If Dr. Kireki was here, he's an infertility specialist from COGS, he could have also mentioned that. So thank you for bringing that up. I want Linus to comment. Yes.
Now, in addition to what you just said, just a quick addition there. I think one of the things for the mothers to be safe is for all of us to practice the top of our licenses. All of us have been trained in a particular way to do a particular aspect of this whole chain. And if we work to the top of our licenses on those different levels, on medication management, anyone who's getting pregnant, who's having issues getting pregnant, look at the meds and you'll see something could be there that is tripping the whole system up. When they are pregnant, what are those medications that are going to be safe for the mother and the baby and the fetus? Then when it comes to time across to the other side where there is a baby who's born, what are those medications that are safe for the mom and also safe for lactation? And all this, I mean, something as simple as folic acid being applied across would just give us better outcomes on children. So I think pharmacists have a very big gap. They have a lot of knowledge that is actually not being called upon at the moment, which would add greatly towards the whole conversation about mother and child care in deliveries in general. Thank you.
Thank you very much. In that regard of medication, there's a comment about COVID and COVID vaccine and maternal health, especially pregnant and lactating mothers. I think there was a statement, was it from COGS or from KMA or from the ministry? I think Dr. Gitonga, you could just comment about that because that is a current issue. We know that that period, they're more at risk. So what is our stand? What is our advice as a country?
The benefits for the vaccine to the pregnant woman outweighs any known risks. Therefore, the current studies that they should also get vaccinated to reduce the risk, both to themselves and the newborn.
Thank you very much. And indeed, that is something that we saw happening. We saw mothers getting very severe disease and even some going to ICU and some not making it. And so it was a drive not only from the West, but from within local data. So we applaud COGS and the Midwifery Association towards making such strong advocacy moves that finally the statement was made and mothers are not being turned back. Otherwise you'll be looked at in the line as you come for vaccination and be told you are not supposed to be vaccinated. Thank you. So we know that IPC is very important, especially in a maternity in a newborn unit. Today I'm at MPSHA and they shared their newborn unit and their maternity, and you could see how they have the various steps and the various aspects of IPC. So I think, Linus, you'll give some highlights on that. You're welcome. Linus, are you the one sharing the slides?
Yes, thanks, Dr. Kutoya, and thanks for this opportunity for us to see the critical aspect in terms of IPC. So IPC is really very critical, and especially for the mother and child. And what you can see here is that, as we know, currently quite a number of mothers, and although I don't have statistic, but our colleagues from MTRH can tell us from the COGS, the number of CS that we perform, in our setup have really increased. And one of the greatest risk in this is really surgical site infections, whereby you find that the incidence is between 1.3 per 100 operations. And this really varies depending on the type of operation. And surgical site infections actually account for about 20% of all healthcare associated infections, leading to the increase of hospital stay with about 7 to 11 days. And what we've learned in infection control is that 60% of these surgical site infections are preventable. And it will be very, very important really to know what are the main risk factors for this. And one of them is really lack of proper hand hygiene and in our healthcare facilities, mothers sharing beds, lack of an effective infection control program in most of our units, and shortage of trained staff. And one of the things that some of the previous speakers have said is that shortage of staff, whereby a mother comes for delivery and there's one staff and one takes care of the mother and there's no one taking care of the baby or whoever, there's that kind of a lot of stress for the healthcare workers, leading really to the mothers getting this kind of a challenge. One of the things is that it actually, as you can see, these pictures of operations links that if it's not well done and in terms of infection control, links to one of the pictures that I think I showed there before, burst abdomen. And these are some of the pictures really have been taken from our setup. So we need really to improve. In fact, even when the patient has been treated, taken to the ward, one of the major challenges, again, as I mentioned, is hand hygiene. If one personnel, let's say for a nurse, is taking care of 10 beds, and these 10 beds may be having 10 patients or even 15 patients because of sharing, they have at least 90 contact routes of this patient. And therefore, if there is no increased proper hand hygiene, this nurse can actually, or this healthcare worker can transmit any microorganism to this or 2 or 3 of these patients that should be handling. And so it's one of the important things that we have seen is really to document and see what's really happening. So you can see on that slide that a pair of a healthcare worker's hands before hand hygiene, you can see really tracing the microorganism on the hand. And then the second on your right is when the hands have been really cleaned. So what we're trying to do is really trying to make the invisible to be visible so that healthcare workers can really understand the importance of proper hand hygiene and improving the care of the patient that we are taking care of. So with that, really, it requires us to have systems in place so that healthcare workers are really enabled to really do the hand hygiene and do the proper sterile techniques in our setup. So this requires that wherever, and especially in maternity wards, there are proper hand hygiene stations, there are proper sterile gloves, proper PPE that the midwives are able to use and be able to attend to our patient that we're having. And as I finish, in short, is that you can see this a ward round, and whereby the healthcare workers are discussing patient, reviewing patient. You can see how these patients are. And at that point, you can see that there are no availability supplies for enhancing hand hygiene. So after all these healthcare workers who you can see and discussing this patient may have touched all these patients, but they have not had a chance to do in hand hygiene. That really requires us to improve in terms of infection control and to be able to, once the mothers have delivered, even reviewing those patients, the newborns, then they are being done at the right moment. So with that, thanks, and back to you, Dr. Lydia.
Thank you very much. I think the panelists have done us good, and we just appreciate COGS had actually logged in. Their president, Dr. Kireki, had logged in. For some reason. He had to drop off for a meeting. So we are really grateful. I think it is the midwifery chapter that got cut. I think they dropped the communication. In case Eunice, you are here, you could give the last remarks on behalf of this professional team as I hand this back over to the moderator. Eunice, are you there? I know you dropped off before you finish. Yes, kindly
Yes,
give
I
any
dropped
remarks.
off and I hadn't completed my remarks. Thank you so much, Lydia. And I just wanted to echo what our vision is as Midwives Association, that every woman and every newborn to have quality midwifery care. So I think this one is in keeping with the theme of this particular event, World Patient Safety Day, Safe Maternal and Newborn Care. But then how do we achieve this as midwives and healthcare professionals? I think there are a few things I really wanted us to highlight, and especially when it comes to safe maternal newborn care within our institutions. And I want to begin with preconception care. That is where midwives come in. From preconception care, midwives are supposed to be educating women so that by the time this woman conceives, at least they find a healthy body. Because if this woman conceives when the body is not ready, then there's a high possibility this is the baby, a neonate will be born with complications, and also the mother will have complicated pregnancy session. So we need to reinforce preconception care. While guidelines may be there, but then it is not really being used on the ground. So I think that somewhere we need to do capacity building and empower the midwives to be able to support women during preconception care. And of course, during pregnancy and during childbirth, we need to continue reinforcing safety of women, and especially when it comes to education. We need to identify risk women and educate them so that we prevent any complications that may arise during pregnancy and during birthing session. The other safe environment that I'm thinking we need to consider is most of the time we try to care for women using a risk model, using a pathological model. But then as midwifery philosophy, we are empowering our midwives to be able to provide physiological care. We allow a woman's body to give birth in a natural way. So we need to reinforce that so that women who go to our hospitals are not fearing interventions, but rather will be allowed to give birth in a safe environment that they have been empowered to choose the mode of giving birth that they may have chosen as early as possible. We need to continue with postnatal care. There are guidelines for postnatal care. The MOH gave guidelines regarding a number of visits a postnatal woman needs to be offered. But then that cannot be done if we don't have community midwives. So as maybe MOH, I think we need to empower our society, our midwifery body to be able to offer community midwifery so that we are able to follow up women postnatal, because evidence has shown that complications occur within the first 48 hours after giving birth. And this time the woman has already gone out of the hospital. So we can actually empower our midwives by ensuring we have more community midwives. And then, of course, we are also advocating for training of midwives. In the current status of midwifery in the country, it's showing that there is a, not within the country, but globally, there's a shortage of midwives. So how do we offer quality care when we don't have adequate midwives? And we don't have to confuse midwives and nursing, because according to the ICM definition of midwifery, it's a professional person who has undergone midwifery training for a specific period of time, and that is a minimum of 18 months. So which we don't offer when we are doing nursing. If we are doing nursing, we don't offer that. So we are trying as much as possible to have many midwives within the country so that they can offer midwifery care. And in the event that we don't have the midwife, but we have a nurse in a certain facility, then we need to allow them to practice midwifery, because we are finding in most healthcare institutions, they are transferring midwives who have experience to areas they may not have experience or interest in. So this leads to poor quality, because if I'm interested in a certain area, then I need to be left to work in that particular area. So, and of course, we need to harmonize capacity building for MNH workers. Sorry for my long remarks. Thank you.
Thank you, Eunice. Indeed, you actually carry the trade, and we need to give you that space. Right now in our country and all over the globe, pregnant women at the time of most need are in the hands of nurses, in the hands of midwives. And so we appreciate what you're doing. Continue moving quality, safety, and care with dignity towards this mother throughout our country. Thank you very much. So, and I think we can applaud our panelists. We appreciate the PSK representative, Dr. Nyabero. We appreciate Eunice from Midwifery Association, Dr. Gitonga from MOH, and Linus. Thank you very much. That was quite some insight, and may the Lord bless you. Back to the moderator. Dr. Wesangula, back to you.
Thank you so much, Dr. Okutoi, for leading that panel discussion. At this point, I wish to, as we conclude, I want to invite Mr. Eric Tangara to give a vote of thanks before we close. Karibu, Eric.
Thank you very much, Dr. Irungu, and thank you very much, everybody who has attended. I think this one, we can say it was a very successful event. The launch of the documents and plus the launch of the platform. We've had, at one point, we were 126, which is quite a good number. So I would like to take this opportunity to thank the Ministry of Health, led by the Chief Administrative Secretary, Dr. Rashid Aman. Thank you very much for attending and gracing this occasion. It was a pleasure having you on board. And thank you, Dr. Kibias, the head of the directorate, who has actually sat with us throughout the this event. So we just say thank you for all of that. And for all the MOH staff from the Division of Patient Safety and the Reproductive Health Division. Thank you very much for being with us, and your attendance and your contribution in this activity has been quite useful. So we also thank our partners. We had quite a number led by WHO. Thank you, Dr. Joyce, for gracing the occasion, CDC, head of CDC, and also USAID MTAPS, Dr. Kusu, and the rest. So thank you very much for actually supporting the whole thing. We will not forget our facilities, KNH and MTRH, who really participated well. They've given talks and experiences on patients and how they've been able to mitigate all the challenges that have been coming up. So thank you very much for being with us. And we will not forget ECHO India for giving us this platform that we have been using, and we are also going to continue using it. So we also say thank you to ECHO India and IPNET Kenya that has actually allowed us to use this platform, which we have launched and will continue using for IPC and AMS activities and many other trainings which are going to be coming up. All participants, thank you from all the teaching institutions. I can see University of Nairobi. I can see members from KU, Karatina University. Thank you very much for being with us and actually gracing this occasion. And to our panelists, Dr. Okutoi, Dr. Linus, Dr. Evelyn, Eunice, Sandra, Mugeni, Nyachera, all those who have actually graced the occasion. for us is just to say thank you. The day has started and we'll have a whole week of implementing activities. And I've just been reminded that the theme will remain the theme for this year until next year when we are going to have the other theme. So thank you very much all, and may God richly bless you as we celebrate the World Patient Day, and also looking at maternal and child health. Asanteni sana, and back to you for closure to Dr. Irungu. Asanteni, thank you.
Thank you, Eric, for that vote of thanks. I think we don't have much to do at this point. I wish to call upon Veronica to do for us a closing prayer, and then we can all have a great day, a nice weekend ahead. Thank you, Veronica. Okay, maybe Felisa, you can do a closing prayer for us. Karibu.
Okay, let's bow our heads for the prayer. Our God and Father, we thank you for this great day that you've given us, oh God. Thank you, Jehovah God, for we have been planning for this day and you've made it a success. We thank you and we bless your holy name, O Jehovah. We thank you for everyone who has participated from the time we started planning, and we pray that you bless them and meet them at the point of their need, O God. Father, as we continue to give the service to our patients, we pray that God will help us to make our work, to help so that our patients can be safe and our facilities can be safe, our healthcare workers can be safe. We thank you and we bless you. For in Jesus' name we pray and give thanks.
Amen.
Amen.
Thank you so much, everyone. Bye.
Bye.
Bye. Have a good day.
Bye.
Hi, Mr. Eric, could you confirm if I should go ahead and close the session for today?
Yeah, thanks, Lomana. You can close the session.
Thank you, Dr. Linus, for the confirmation.
Thank you, and thanks for the great support.